Bacterial vaginosis also increases the risk of sexually transmitted infections such as HIV and others. So anyone who has symptoms that could be related to bacterial vaginosis should be evaluated by a healthcare provider. Bacterial vaginosis occurs when there is a change in the number and type of bacteria in the vagina. Lactobacilli are a type of bacteria that are normally found in the vagina. However, in people with bacterial vaginosis, the concentration of lactobacilli is reduced, while the number of other bacteria then goes up. Some of the risk factors. So sexual activity is the main risk factor for bacterial vaginosis. However, bacterial vaginosis is not yet considered to be a sexually transmitted infection. It can be sexually transmitted. It's more common in people who have multiple sex partners, people whose sex partners also have bacterial vaginosis, and in people who do not use condoms. Bacterial vaginosis can spread through sharing of sex toys, oral genital contact, and fingers. Other risk factors include douching and cigarette smoking. So options to reduce the risk of bacterial vaginosis includes regularly using condoms, washing sex toys after every use, and using hormonal contraception if appropriate. Some of the signs and symptoms include an unpleasant or fishy smelling vaginal discharge that is off-white and thin. There can be burning and itchiness, and the symptoms can be confused with other types of vaginal infections. Some people find the odor that is more noticeable after sexual intercourse with male partners, as well as during and immediately after the menstrual period. However, most people have no symptoms. And if they have no symptoms, for the most part, they do not need to be treated for a few situations. Pain during urination or sex, redness and swelling are not typical. If someone has those symptoms, then there is something else going on, and it also needs to be pursued in terms of diagnosis and treatment. The diagnosis of bacterial vaginosis is based on physical exam and laboratory finding. The physical exam could include a pelvic exam, which allows the healthcare provider to observe and test the vaginal secretions. There's also other testing that does not require a pelvic exam, and the patient can do this by themselves, which is what we call the BD-Affirm, which tests for bacterial vaginosis, fungal infections, and trichomonas. Treatment of bacterial vaginosis is recommended for people with symptoms and people who are having surgeries, hysterectomy, even when they have no symptoms. Some people, bacterial vaginosis, it may show up, but if they have no symptoms, they do not need to be treated. Bacterial vaginosis can be treated with antibiotics. There are creams and there are oral options. Usually the most common treatments are metronidazole, clindamycin, tinidazole. Whether it is a topical vaginal antibiotic or whether it is oral, it is more of a patient and provider preference. Some people prefer to take pills, some people prefer to do vaginal creams, for example. They will both work when the treatment is completed, and it is usually a 7-day course of antibiotics. People ask me a lot about sex partners, and treating sex partners does not improve a person's symptoms or lower the risk of infection coming back. Now, sex partners of a person with bacterial vaginosis can develop bacterial vaginosis, and if that person has symptoms, they should be tested and treated if the diagnosis is confirmed. And consistent use of condoms by all sex partners can reduce the risk of bacterial vaginosis. Pregnant people with bacterial vaginosis are at an increased risk of preterm birth. So pregnant people with symptoms of infection should be tested. Relapse and recurrent infections. These can be quite common in a good amount of people. Approximately 1 in 3 will have a recurrence of bacterial vaginosis within 3 months, and more than half will have a recurrence of symptoms within 12 months. Symptoms may return because there is a new infection or relapse of the prior infection. And possible reasons for relapse of bacterial vaginosis includes that the treatment was not completed or it was stopped early, the medication was not used correctly, if the bacterial vaginosis infection was not completely treated, or if the normal level of protective lactobacilli bacteria did not return to normal, then the infection symptoms could come back. Recurrent bacterial vaginosis is considered as having 3 or more confirmed episodes of bacterial vaginosis in 12 months. If that is the case, people may need to be treated with antibiotics. After finishing the antibiotic for the acute infection, some people may be offered maintenance treatment. That is to decrease the frequency and severity of bacterial vaginosis infections. And some of these medications could include metronidazole gel twice a week for 4 to 6 months, intravaginal boric acid, and some other medications or options. So lowering the risk of recurrence, finish entire course of antibiotic treatment, use condoms correctly and consistently for all types of sexual activity, consider hormonal birth control if it is indicated, and do not practice any vaginal douching. Douching is the use of a solution to rinse the inside of the vagina, and there is no proven benefit of douching. I hope this topic was helpful. Always remember to discuss with your healthcare provider any further need of diagnosis and testing, and also remember to like, share this page, and suggest other topics in the comments. Thank you so much.